Dr. Rubenstein, lots of people in this country are wearing dentures. And, most of us know, dentures. We know grandma, and she looks not so good. She takes them out and put them in the glass at night. Now, there seems to be these dentures have to be advanced, apparently, seem to have advanced. And there's this new thing called an implant-supported denture. And maybe there's a different name for it too, but I call it, a hybrid. You have your dentures, but you also have a couple of implants which apparently hold the dentures in extremely wonderful, and it's apparently to a normal denture like day and night. Now I want you to tell me whether that's true and what is there all do it. Is it really the next thing to sliced bread? Is it a little bit like that or not?
Well, the answer is yes. I mean, I don't wear dentures, so it's the one question that people have asked me, and I can't really give them an answer. But looking
well,
at the,
they should be happy if a dentist kept his own teeth. I mean, that's a that's a good dentist to go to.
That's the hope. The answer is that in the system of care today, the dentures have usually been okay for people, not great, but okay for people for upper dentures, and lower dentures have just been a miserable experience. And the reason is because you can get some suction on the palate going to the denture and hold the upper one up, and the lower one is really there by the gift of God and how much bone you have and gravity, and hopefully your tongue isn't kicking it out. And the answer is dentures don't fit, period. When I was a resident a gazillion years ago, we had one of my attendings was doing a denture study, and he did this cinescope, which was basically or fluoroscope, which was x-rays and film, and he had people with the best fitting dentures and the worst fitting dentures, and what we saw was that the best fitting and the worst fitting dentures didn't fit, and in the process of chewing, people's tongues would push up or push down to keep these things in their mouths, and it was reflexive. They're inefficient at chewing things, and because of the movement, they lose out taste because a piece of plastic is going across your palate. And so now with the advent of implants, the answer is yes. We can, depending on what the situation is, the amount of bone you may have, the number of implants that we can place due to financial needs or whatever, the answer is that you can actually get a lower denture, that you can have 2 implants, and sort of like if you had a snap on something, that you could snap the denture onto the head of this implant and click it in place so the person really couldn't kick it out. They could bite off on something and not the fear that, the thing's going to pop up and out on them. If you put enough implants in and they're missing a lot of bone, the answer is that the pink plastic that looks like gum can be a very wonderful effect of dentures compared to maybe crown and bridge, where you're missing a lot of bone and you have teeth that are excessively long or whatever. And so the answer may be the fact that you have implants supporting an upper denture where you can have teeth of normal size and gum of normal size and looks perfectly fine. And the nice part is that you can have nothing sitting, well, let's put it this way. Most of the palate is clear, so you now don't have something running across your palate. You don't have to worry about it falling out. Your taste buds are fine on your palate. Your tongue is fine. And, if you bite into an apple, you're not going to worry about the fact that suddenly your denture's in the apple, or I can't bite into corn, or a bagel. So,
wow. That's a big one. So basically, you're saying here 2 things. Number one, very important, because most of us like to eat. That's just like internationally around the world a good thing to do, to eat, to taste food. And so you can taste food better because your palate isn't covered with this acryl or with this metal or whatever it is made of, in order to have a suction, so that you can cut that loose so now the person can taste food better again. The person, you say, can bite into an apple, corn, basically chew on a spare rib barbecue, and he doesn't have to worry about it falling out.
That's correct.
Never mind having to worry about it falling out when you're with a party, Thanksgiving or whatever, and you laugh and have fun, kind of, because you're not worried. You're worried it falls out. It might not fall out with a normal denture, but you're worried because it's it's a little loose, and so that isn't happening anymore. Now let me ask you this. Obviously, this is a huge. Denture is probably the cheapest way of replacing all the teeth. So it's like a money thing. A person with lots of money probably get all implants, talking $50,000, $60,000, lots of money. Do you know what I mean? And a denture obviously is like a fraction of that. Now, an implant-supported denture is a little bit more than a denture because you put like a couple implants in it, maybe 3 or 4 sometimes, whatever it might be. So it's still a lot cheaper than all implants and a little bit more expensive than a denture. I think that's probably a wonderful combination, especially for the. Would you say that for the amount of money you pay for the implant-supported denture versus the bridge, versus the normal denture, that the investment is an enormous return of comfort? Would you say that's a yes?
The answer is yes. As a matter of fact, the standard of care today in dentistry, not to say that you have to meet it, but the standard of care for a lower denture would to be minimally have 2 implants placed for this denture to attach to. That doesn't mean that every person who, especially elderly, who may not have enough bone to support this, but if they do, the amount of cost that's extra to them compared to the cost of the misery of the denture and the adjustments and the time of the back and forth is negligible and probably can be worked out financially anyway. So it's
beautiful.
It should be what you should do.
Beautiful. Now let me ask you this: a person comes in and he doesn't have a lots of money and he needs his denture. Never mind implant; it's out of the question. So he gets his denture, but he doesn't have enough money to put in those 2 implants. Could he get his denture today and save up for his 2 implants 2, 3, 6 months down the road? Is that a workable system, or is it all or nothing?
Well, the answer is it's workable. As I said, I don't place the implant, so essentially I would probably have the patient see the surgeon even if he wasn't going to put the implants today. So I know the places that he's going to place the implant, so I can sort of make arrangements that when the implants are placed and I sort of know where they're going to go, that we can sort of modify that denture, hopefully, without having to remake it, to fit both the implant and the attachment into that denture, and they can, get it done. Beautifully. I don't care whether it's 6 months or 10 years from now.
So you can build on it. Like saying a person gets 2 implants on the top or on the bottom, and maybe he a couple more or 1 more would even be better. But he can again fit that 1 or 2 more in down the road. So he can build on it. That's absolutely wonderful. That's wonderful. Right. Well, it does look like it's the best thing after sliced bread, because now you don't have to eat sliced bread anymore. You can actually bite into one of those real big German hard bread where the crust is thicker than the bread. Thank you very much.
Which is